Hold on. What's happened to my screen here? Hold on. Can you not see my screen again?
Yeah, we can still see the slides perfectly.
Okay, I don't know what's happened there. Oh, fantastic, great. Okay, so, well, hello everyone. Well, thanks a lot. The title of today's talk really is on post-COVID challenges to imaging, a new dawn. Tan and I are representing Imperial Medical Solutions. So first, I'd like to thank Sean and his team at Convensis for inviting us. You know, always a professionally run conference. I always enjoy the content. So thanks, to Sean for inviting us. Just a bit about Tan and myself. I'm a consultant pediatric radiologist within the NHS. I'm also the chairman of Imperial Medical Solutions. And I'm honored to have Professor Tanner Ralamplam, who is the CEO of Imperial Medical Solutions and himself an NHS consultant. Imperial Medical Solutions, we are a clinically led clinical leadership and clinical strategy consultancy organization. We provide focused support to the medtech industry, and through our journey, we forged alliances with partners in the UK, Southeast Asia, the Indian subcontinent, and the Caribbean. And we're proud to say that Convensis are our strategic partners. And really, the underlying principle at IMS is promoting patient safety through clinical leadership, technology, and human relationships. Tan, myself, just sorry, Tan, if this is a bit of a shock, but I managed to find this among my files. But Tan and I have known each other since 1996. I was his SHO when he was my consultant. But even since then, we've always worked together. This is one of our projects in '96 where we tried to provide a free education through support from industry, and it was successful. We had about 3 various educational events, and it's actually nice to see organizations such as Convensis now taking on this mantle and sort of continuing this sort of philosophy where we work with industry. And now in 2021, we are now working together at IMS. IMS, of course, over the last 8 months, we've grown quite fast. We've got a global team. We have a team in the UK with Mr. Samuel Haq, who's our medical director. We have a team in the Caribbean, and right now they're active with the first Caribbean robotic surgery program, and we hope to have that up and running in the next 3 to 6 months. We have a team in Asia too with 2 separate projects, and through careful strategic partnerships, we have a growing web of family members joining IMS, sort of extending our reach worldwide, and we are growing. And so, what are the lessons from the pandemic? And I'm sure Sean himself will be excited to see something crop up next. But let's talk about Jurassic Park. Now, one of the things that's always baffled me about Jurassic Park is somehow they have never ever learned from lessons. Jurassic Park happens, dinosaurs, suppose, they've learned dinosaurs do eat people up and can cause quite a lot of trouble, but they continue to repeat their mistakes and create another park and another park and another park, and on June 11, 2021, another park. So somehow, if you learn from Jurassic Park, we need to learn from our previous mistakes. Other things, of course, is don't mess with dinosaurs, and don't be a dinosaur. I think that's a critical thing. And I think with the NHS, it's all about moving forward. We don't want to always stick with the old ways. And that is why I have Tan here talking about dinosaurs. I suppose, Tan, why do we have a surgeon joining us today at this meeting?
Well, I don't know quite how to take that, Ram, and I'm sure in a Zoom full of radiologists, you'll be happy to think of me as a dinosaur. But the real reality is, like radiology, general surgery, the whole of medicine has had to put rocket boosters under every single process, everything we do. We have had redeployment and the fear and anxiety that causes. We've had additional work, which because of being connected 24/7, can go on and on and on. And you as radiologists know how difficult that is with your workflows that you can access at home. And the third thing is training has been absolutely destroyed. So we have had some experience, and we've had some really novel, innovative solutions. So I would like to take you on to another movie So if you go to the next slide, you know, Independence Day was a crisis, and we had to, you know, in that movie they learned about what has gone on. And I think, you know, as Einstein said, you know, the mark of true intelligence is the ability to change. And I think we as a medical community need to harness that. We need to use technology. We need to change using the experiences of the past. So, you know, my question to you, Ram, is what have you learned over this period?
I think if we were to use Independence Day as an analogy, it's like Independence Day. COVID presented us with a new unseen enemy. We had limited resources, but we had to draw those resources together as a global effort. And if you draw a line with the movie, you know, it's when all those fighter jets came together to fight back and to defeat the alien enemy. And they used existing technologies, which is what we did. But we were able to draw on all these resources, and, you know, with fantastic ideas like Project Warp Speed and how the radiology community came together. It was really interesting seeing the talk from Sectra on how artificial intelligence has really taken a great leap because of COVID. And then with those lessons, we moved towards Independence Day resurgence, which is now we have this time, I think. It is not a matter of if another pandemic is going to occur, it's when the next pandemic occurs. Unlike the movie, they've had 20 years to prepare. I don't think we have 20 years. We probably have another 2 to 5 years, providing that things stay the same, but we know they're going to be COVID variants. So I think in radiology, we have this time now to rearm ourselves. Sorry to use the military terms, but to rearm ourselves and to prepare for the next onslaught. I think, you know, lessons learned, I think we're in a good position. And so, Dan, if you could just take me through some of the things that happened in surgery. I know in surgery, for example, surgeons saw a massive paradigm shift in the way you did clinical work from open surgery. And I know you were one of the pioneers of minimally invasive surgery, namely laparoscopic surgery. There must have been a change, plus the fact with European working time directives and working time regulations, training must have been hampered. You know, I'm sure there's something we can learn from the surgeons from a radiology point of view.
I mean, I think, thanks, Ram. The Association of Coloproctology brought together, you know, if you like, some senior experienced clinicians as well as some younger surgeons, and we looked at what had just happened. We often don't reflect very well, and the musings of the dinosaurs and the young dinosaurs was that there were 3 areas where we had changed: the healthcare system, the workforce, and how we approached innovation and technology. And they looked at these 3 domains and saw that these were the areas of prime focus that we should look at going forward. And we should make it very, very much patient-centered. So the patient is at the middle. Look at this infographic. You can see the patient is at the middle of this.
How are you doing?
And the healthcare system basically is going to change. We may have hospitals aggregating. We may use centralization. This is an excuse for centralization. In terms of workforce, we know that training has been destroyed, and we know that some units are not fit for purpose for training. And in terms of innovation, you know, the innovation window is usually quite small, and that window can close very quickly. So if we focus on those 3 areas, then we can move things forward. And there was a paper, the legacy paper by the Association of Coloproctology, which I co-authored, really focused on these areas, and I think is a good start for anyone looking to go forward.
No, thanks a lot, Tan. And I think just encompass that in a world of radiology, and I think we're all related. We're all, at the end of the day, clinicians. I think what you've just said, I think I was going to encompass it. I think, you know, COVID-19 presented us with a steep learning curve, not only in just technology, but the understanding of the pathology. It showed that we had to pool our existing resources, but we are able to fight back. And we're now at the stage now where the fight is now, we are hopefully winning. I think the key thing, as you had mentioned, is a culture change. You know, there was a crisis to healthcare. We had to look at what were the opportunities for our workforce to really prepare for that, for the onslaught from COVID-19. But I think that those requirements have sort of led to an innovation, and that is why we're seeing sort of this giant leap now in innovation and technology within healthcare, in particular within radiology. And I think we need to grasp that bull by the horns in a sense and really take that opportunity. And I think in moving forward, it's about building resilience and having a paradigm shift, working with technology, working with people, and moving forward. And I think if I can move on to the next slide, Tan, I think, you know, looking at radiology, what are the key challenges ahead of us? And I think just from experiences in the last 1 year, I think digital literacy and security are critical areas. Training and how our training is affected by COVID, especially the reduction in work volume for our registrars and for our healthcare workers. Resource management, already radiology was challenged with its resources, especially with Brexit, with retiring radiologists. We're not producing enough radiologists. Now with COVID, it's a further blow. And I think we cannot forget well-being. I think the well-being of our staff is absolutely critical. And it's great to see the GMC, for example, centering on well-being. And to add to that mix, I think, you know, the recent policy paper that's been released and is waiting to be signed off, the integration, innovation, working together to improve health and social care for all, this alone is going to have a significant effect on how we move forward. I don't know, what are your thoughts on this new paper, Tan?
Yeah, I mean, I think this is where we have to come together, and I think the pandemic has really made us look into our souls and say, you know, what role, what job did we all want to do? And actually, if we take the grown-up approach and look to help with the solutions, we probably will have a lot more job satisfaction. I think that's been one of the key learnings for me. I think governments cannot carry on to provide healthcare as they are. You know, healthcare costs are rising in double-digit percentage points every year. So we have to now find the Uber of healthcare. We have to find out what works, what doesn't. Smart, you know, I always say, as you know, work smarter, not harder. And I think government has to establish a framework within which we should be working.
Thank you very much, Tan. And I think I'd like to move on to digital literacy, which is going to be, you know, one of the main challenges. I think one of the great things with the NHS was they really tried to mobilize digital literacy, making sure that everyone is connected. But I think a lot of us, some of us are very comfortable with technology, and some of us may find it slightly more challenging. And it's just trying to get everyone through this journey. And we can see how technology, especially the way we communicate, and the way we teach, has worked its way into telemedicine and MDTs. I do all my pediatric radiology meetings now via Teams. How education's been affected. I connect with my registrars via Teams these days and invite them for MDTs. How do we deliver training with limited resources, and how can we use technology? And of course, we talked about well-being and how can we integrate well-being. We've seen Microsoft, for example, they've released a new software called Viva that integrates well-being into their workflow. And of course, and I think it's really, really critical, is security. And I feel as a clinician, as a radiologist, moving forward in terms of appraisals, we should include digital literacy as part of our CPD. It cannot only just be clinical now. I think part of the discussion, part of dialogue, is how do we enable our workforce to be digitally enabled. And I think all of this, the literacy and technology will help us be a bit more resilient if something will happen again in a few years, like COVID. And I'd like to move on to security because I feel we've caught up with we've caught up with technology, but I still think there's a way to go when it comes to security, in particular patient confidentiality and data. And I just want to highlight these two cases, or these two events that's been trending recently on the internet. The one on your left, of course, was the case of the lawyer and a judge, where the lawyer had a kitten filter put on. And the one on the right, of course, if anyone's up to date with what's been going on in YouTube or on WhatsApp, the Handsworth Parish Council Zoom meeting that was recorded and put in YouTube. Now, a lot of people found this quite humorous, but actually, if we would transfer this sort of issues into the healthcare sector, imagine if that Zoom meeting with a cat filter was with your medical director, or you were breaking bad news. Or it would actually be quite embarrassing if it was actually an MDT. And talking about MDTs, imagine if you had poor security functions and somebody had jumped into the MDT, which is quite easy to do these days. Hackers are very smart, recording it and actually putting it in YouTube. So I think what these two events have shown us, and I think it's going to be a theme moving forward, is we've all learned to use technology, but I don't think we need to take it very, very seriously. What it's showing is it's revealing the cracks. The cracks are now appearing, and we need to start working to sort of iron out or close those cracks. So I think, Tan, do you have any comments on this, Tan, in terms of security?
Yeah, I think, Ram, you make a really important point. It's the pandemic has made everything a bit Wild West, because we've sort of supercharged the use of technology. We've done, in our field, we've done video consultations, we've done telephone consultations without proper training on the technology, but also on the way this should be done and on how we interact with our patients. And I guess for radiology, you've been very used to doing telephone consults with secondary care clinicians. But there is also some behavioral aspects that need to be trained. This needs deliberate, active training, this new world that we live in. So I think this Monday, there was a news release of a surgeon in theatre in California attending a court hearing, so very inappropriate breach of security with lots of issues around it. So cybersecurity and behavior, how we interact in that space is very important. And I think this is, you quite rightly highlight it. And I think this is something that I'm very passionate about, how we do these things.
No, absolutely, Ken. And I'm sure as a surgeon, you'd agree, and even as a radiologist, before we use a piece of equipment, albeit a PACS software or a computer equipment or an interventional device, and I'm sure in surgery you're using surgical devices, we have to be extremely competent before we are signed up to use those devices. And I think we need to see telecommunications, telemedicine, and all technology as medical devices, and we should also aim to gain competency in these devices and also understand the security implications. Hence why I'm a proponent that we need to include digital literacy as part of our CPD and appraisal process moving forward. And I think that brings us to training. I think as a college tutor for my trust involved with education of our registrars, we found COVID has significantly affected the volume of work and the access to training. A lot of our registrars, for example, are not getting ultrasound experience or as much as they used to. Our caseload's going down. And so we're having to sort of manage our resources in sort of learning. But I know, Tan, I just mentioned earlier on, surgery was sort of faced with this at one point when European Working Time Directives were introduced, and gone with the days of 24/7 on calls, and now time was controlled. How did surgery manage to still produce high quality surgeons with those constraints of time and work availability?
Well, I think it took a long time for us to go from this apprenticeship model to a competence-based training. And once we made that shift over the last 10 years or so, it is interesting because, again, the dinosaurs took a long time to understand how you use the competence tools, which are inevitably digital. So we have something called the Intercollegiate Surgical Curriculum Project, ISCP, that we have as a baseline for the assessments of our trainees. And what was really lacking initially was the training on these tools. So that's just a bit of basic housekeeping. How do we do the training? Well, we've put in simulation. We've developed remote simulation over the pandemic. And we've also become much more focused on developing a community of learners. So, you know, for those people who've got kids, or perhaps those of you who are big kids, if you play Minecraft, you build your own world. And what we're trying to encourage our surgical trainees is to look at what they want to achieve, look at where they're deficient, and build their learning environment using a blend of now hybrid models of remote learning, plus going into the laboratories, using different simulation models, and then getting scored on it. So you're not just doing it on your own, you're getting somebody to actually give you some decent feedback. It's a slow process. It won't happen just overnight, but one has to acknowledge that this is the new world. And the pandemic has, you know, it's had devastating effects overall, but there are some real seeds that we need to say, this worked and we must carry it on. My fear is that everyone will be so desperate to go and do things how they used to do it. And that is going to be one of the biggest dangers of the post-pandemic recovery.
Thank you very much, Tim. I think radiology, in some ways, we position ourselves digitally to be able to deliver education. I think there is a move to networks within regions. We know the teleradiology companies are supportive these days in terms of education. And how do we use our available resources? You don't need 10 consultants doing 10 lectures on how to report a chest x-ray, when if you can connect everyone via Teams, you can have one consultant teaching 100 trainees, which means that you're releasing workforce back into the NHS to get out of COVID. So I think it's about networks, about integrations. I think, like I said, it's about learning smart. And I just want to quickly move towards resource management, which I think is really, really critical, because we are facing a scarcity of resources post-COVID. And really, I think instead of forging ahead straight away, we need to take a step back and really look at the landscape. And is there room for improvement? Because there's only so much money, there's only so much time, and there's only so much equipment. And I'm just going to talk about, a bit about resource management. And I would like to thank Walker Business Transformation, one of the partners at IMS, who sort of talked me through this and allowed me to learn about, lean management and how we work with limited resources. I think the first thing is about respecting people. I think if we just take that from a local level, it's actually respecting the members of staff within the radiology department. If anyone remembers my talk on clinical leadership during the pandemic, it's about drawing on those various resources, listening to members of staff, trying to enable them. We've got a lot of advanced practitioners. How can we use them to work through our workload? And of course, respecting our colleagues, our clinicians, and listening to them and prioritizing cases. And beyond the walls, of course, how do we work with our colleagues in other hospitals? In other words, how can we create networks? And then, of course, understanding the variations and aim to reduce those variations. And what this means is that we are sometimes too target-driven, Tan, I think. We have to understand that there may be variations in our day-to-day activity. Some days we might do 10 cases, another day we might do 16. But as long as we strive for continuous improvement over time, then we will see a long-term increased trajectory or increased improvement. But variation is normal, and the aim is to continuously close that loop. And that will, of course, help us better use our existing capacity. And that's where I want to talk about the waste work and value work. Do we need 200 chest x-ray or 200 imaging throughout the day? How do I work with a clinician such as yourself to be a bit more specific on who needs a study, who doesn't need a study? And we reduce waste work, we increase the value work that we do. And that, of course, has a positive impact on patient care. We're not doing too much. We reduce the burden on the department. We reduce the psychological effects on our radiologists, and we reduce the amount of errors or mistakes that can happen. And of course, we don't have patients getting lost in the system. So I think all of this is encompassed with sort of lean thinking. We see in NHS Trust that we've got digital transformation champions, we've got people and culture champions. We need to also have champions on how can we use resource, how can we bring resource management, lean thinking. I don't know, do you have any thoughts on that, Tan, and how clinicians and radiologists can work?
Yeah, if you go to my next slide, what you've just described, looking at this target-driven culture is not great for human beings. for us, we need to have a sense of purpose and achievement that drives us. We do need some targets, but if you're constantly scrutinized, it's very psychologically damaging. It's the bullets every day that get us, not the one big earthquake. And I've published on burnout, and I've published a review on the factors associated with burnout. In the NHS, the number is estimated to be well over 50% of senior clinicians, consultants having burnout. Burnout is defined as a state of depersonalization, emotional exhaustion, and a sense of reduced personal accomplishment. And it has a huge impact, both personally and professionally, as you can see on the next slide. So I'm going to run through, and there are some graphics that come through it, but it can affect relationships, financial matters. There is a high rate of substance abuse amongst doctors, and we've normalized all of that. And the rate of suicide is very high amongst doctors as well as nurses. And it is the minute one is reported to the General Medical Council, that person is vulnerable. And Claire Gerarda, who runs the practitioner health program for doctors who are sick, will tell you the first thing to do then is to go and see your GP or your occupational health and take advice there and then, acknowledge that there's a problem. But on a professional level, if you're burnt out, you're disengaged, your performance drops, and there's a high staff turnover, and there is some evidence of increased patient safety incidents. Now, that may be because burnt out doctors are more likely to report, so it's an area of controversy. The point is that burnout has significant personal and professional problems, and if you want to bring your best self to do your work, whether it's as a surgeon like myself or a radiologist, you have to take this seriously. And at work, Ram mentioned the culture and well-being of those around us. We're not just automatons that just go and report X-rays. We work in an environment that has to have safety primarily there, and that will require certain behaviours and attitudes. So my next slide illustrates this. I thank Ben Tipney, again, part of MedLed, one of our partners. So if our psychological state is like a very delicate vase and we want it on a table, that table has to be flat, and that requires behaviours. And those behaviours are civility, kindness, empathy, and assertiveness. Those are basic behaviours. But to keep the table up, you need attitudes. And those attitudes are trust, respect, humility, and curiosity. So these various tenets give us this psychological safe space where we can speak up if there's a problem. And in your world, what happens if you have a bad report, if you have this constant feedback, negative feedback. So it's all about changing the culture that you're in, whichever speciality. It has to be slightly adapted.
Thank you so much, Tan. I think as a radiologist, and I'm sure a lot of radiologists like me can relate to this. You talk about disengagement, but actually for some radiologists, it's continuous engagement when we actually now have our reporting stations at home because of COVID. And a lot of us now have sort of got a hybrid working model, working at home. And like a surgeon, sorry, Tan, you can only do an appendectomy at work. You can't do it at home, but I can still diagnose appendicitis at home. And I think when you talk about burnout, when you talk about stress in working, I think radiologists are at risk, and I think we need to take a step back, look after ourselves, and look after those around us. And I think just to round everything up, Tan, I think we couldn't answer everything today, but I think what we're hoping to do today is really open up a dialogue. We need to start thinking differently as we move forward, and knowing that the next 2 to 3 years are going to be different and challenging. And that means we need to pivot and shift and change the way we do things. And that will allow us to be a lot more agile and a lot more adaptable, which is something that IMS ourselves as an organization like to believe in. and realize that sometimes the old ways may not be the only way of doing things. That we have now been presented an opportunity to reassess and reevaluate the way we do things within the NHS, with a new paper coming up, a new policy coming up. How does that affect the way we work? And as we move forward, I ask all clinicians and also all radiologists, take a step back, ask, learn, then we can progress. But if we don't ask and we don't learn, I think we're going to be facing quite a few challenges. But, I think that runs everything up. And I know, Tan, you're talking on the 18th of March on the smart surgery. Would you be able to give us a bit of a teaser on what you're going to be talking about on the 18th?
Yeah, so this is all about the small things, the attention to detail. What I would say to you is the marginal gains, the small 1% add up to fabulous outcomes in surgery. We see great surgeons with fabulous outcomes, and we say, why is he or she so good? And it's because of the whole process that they're involved in, and they take ownership of that process. They don't just do the cutting. So my real theme on that day is not going to be really high tech. It's not going to be really low tech. It's all about how you process that as a clinician. It's part of our leadership ethos in IMS.
And do you think a radiologist like me will find some value in that then, Dan? I'm sure I can.
I won't call you a dinosaur if you come. Please do.
Thank you very much, Dan. And I think one thing we're really excited of with our partners at Convensis, alongside the Department of International Trade and the Foreign Commonwealth and Development Office, is the Adapting and Innovating the Future of Healthcare International Summit on the 26th of June. We've got some fantastic industry leaders talking, in particular members from the Wellcome Sanger Institute, the people involved with the detection of the COVID variant, UK Bioscience, who are part of the government drive for increasing testing. And we also have Seth Toback, who is the VP for medical clinical trials at Novavax, that produced one of the vaccines for COVID-19. So we've got a great lineup of speakers, and I think some of the things that we touched on today, Tan, are going to be discussed a lot more extensively at this conference, working with our partners in the Caribbean and with the Department of International Trade and Foreign Commonwealth Office. And I thank Convensis for really helping us put this together. So thank you, Sean, and your team. Really, you guys have been working phenomenally great and fastly helping us deliver this. So with that, I know we've gone ahead a bit over time, Sean. I do apologize. But I'd like to thank everyone for your time, and we welcome any questions on this sort of whistle-stop journey on really the challenges that's facing us in imaging for COVID.
Firstly, thank you very much, Ram. Thank you, Tan. I don't even know where to start with that presentation. So much good stuff. I think some of the key takeaways are definitely don't mess with dinosaurs and don't be a dinosaur. We'll definitely, but just going off what you were saying, Ram, something just popped into my head. But obviously, you were saying about the opportunity to move forward, and what we're planning to do with the International Summit is really create like an ecosystem of professionals that can really help. And it just kind of brought a bit of a phrase to my head as well, which we're going off these analogies and stuff. And obviously, at the moment, we're all under a great deal of pressure, aren't we? Diamonds are created in pressure. So there's another analogy for you. So we've got a great opportunity now to go forward and work together. But just a few quick questions we'll go through. I've not got much time at all, but we'll get one out if that's okay. Mohammed, I will send yours to the team directly because we've had a question from you previously. So we'll go for Pamani's question. Sorry about that. So Pamani has asked, radiologists are working from home, subject to the question. Is this the way forward now to do more of this when reporting scans and x-rays without distraction will create higher throughput, or does social interaction at work also create a better throughput for better productivity? Great question, Pamani, thank you.
Well, I'd like to take that question first. I think it's a fantastic question because working from home is one of the new trending things right now. I think it's all about a balance. I think working from home has some strong advantages. Firstly, from a clinical point of view, you've got no distractions. Absolutely correct. You're able to get to your work. There's less tiredness because you're not commuting. You're able to just get up in the morning, say hello to your family, lock yourself up in your room, and just continue working. But also think about the environmental benefits of working from home. We're commuting less. this will, of course, have a massive impact on energy. And I think that's something that's really important. If you think about hospitals, you're using less resources, less space, creating more space for other things to be done in the hospital. But I think we also have to think about human relationships, connections. We are, at the end of the day, in the UK, proudly clinical radiologists. What clinical radiology means is constant communications with our clinical colleagues and with our patients. So I think there needs to be a balance of working from home, but we need to be at work because of social interaction, maintaining our relationship with our clinicians, and making sure that the members of staff that we work with know that we're there to support them. So I think we all have to find that balance, and I'm a proponent of finding that hybrid. Tam, I know as a surgeon you have to be at work most of the time, but any thoughts on that? At least from a radiologist, how would you like to see radiologists work?
Yeah, we've learned a lot. I think the important thing is we do need social interactions and to keep the team together. So having a Hill Street Blues sort of meeting, whether it's on Zoom or WhatsApp, is really key. The second thing is you've got to work smarter. So having massive ward rounds with excess people, we know is a problem. I'm not aware of any studies showing what's happened to infection rates, but I would hazard a guess that they will have reduced because we have far fewer people in that environment. So I think we're learning a few things. I think the other issue is that we need to look at the really good stuff, like the interaction in education and education meetings and multidisciplinary meetings is great. So I think we should take those things away with us. Unfortunately, at the moment, I can't do my surgery remotely. So, I do. It's kept me sane going in and seeing people. A bit scary occasionally, but it's kept me sane.
Like I said, I've got 2 girls at home, 8 and 3. So I think sometimes going to work is also a bit of a break. So I think every parent can relate to that. I think it's a great question, Sean. Thank you.
Thank you. No, not a problem at all. As mentioned, we've got Mohammed Ismail, who's also asked a question, but what I will do, if it's okay, chaps, I'll just link you up directly. He's asked a very, very valid question about your approach and advice for junior doctors. So really good question. I'll be a pleasure to link you up afterwards. So
thank you very much.
Ram, yeah, thank you very much. And just before I stop, I just wanted to reiterate something that Tan said, which was it's the bullets every day that get us in our day-to-day role, not the huge earthquake. So what a great way just to kind of end that presentation on and just let everybody know that it's we're all human, aren't we, at the end of the day? And we are all fighting for the same cause. So, yeah.
Absolutely. And again, thank you, Sean, for such an amazing opportunity to speak today. Great team behind you. Thanks for the consensus.
Thank you. Thank you, everybody.
Bye.
Bye. Cheers, Ram. Cheers, Tan. Right.